My name is Stephen Pro. I'm an orthopedic surgeon and I've been in Lawrence since 2012 as a part of Ortho Kansas. My practice is largely centered on athletic-related injuries. I take care of injuries that include the knee, hip, and shoulder. Not all of those injuries require surgery, but most of what I do when it does come to surgery is minimally invasive outpatient-based procedures. Within the realm of orthopedics, I'm subspecialized in orthopedic sports medicine. What that entails is not only the care of the athlete, but athletic-related injuries. And specifically, the fellowship I completed was in minimally invasive techniques. So most of the work that I do is arthroscopic, or through the fiber optic cameras with minimal incisions. Doesn't mean that it has to be an athlete that I'm caring for, but most of those injuries are related to activity and/or staying fit and active. What I enjoy most about being a physician is getting to know individuals, helping them through an episode of care and seeing them through that. I like to think of myself in some capacity as an educator. I'd like to educate the patient on what their condition is, hopefully make them engaged in what choices they have to help them get better, and ultimately set goals that are achievable either through surgery, medicine, rehab, whatever way they see fit. I am married. I have two wonderful daughters. Love spending time with them. When I'm not working, certainly enjoy travel with family. I enjoy exercising, and since moving to Lawrence, I've gotten the triathlon bug, so active with the triathlon community, and certainly want to kind of live what I preach. I think that patients should feel very comfortable coming to LMH and specifically Ortho Kansas for their care, because every one of us strive to provide the highest level, most current, up-to-date care possible. And we also want to be a very convenient access point for patients, and so we want to blend elite care with very patient-centered, easily accessible care that's local. I think one of the things that I'd like to share with potential patients are stay active. I want to think of myself not only as a surgeon, but sort of as a personal trainer or a coach, because there's multiple ways that we can help each individual through their need for care. And my hope is to really empower the patient to be involved and engaged in the decision-making process and help them set goals. And whether or not that ultimately leads to surgery is not a priority. The goal is to make sure that we're doing what that individual needs. And so I think as part of my practice, I'm trying to incorporate that and engage folks to stay active and live not only a short-term but long-term healthy, active lifestyle.